Good morning. This is Meredith. We're just getting ready to start. Who joined?
This is Roseanne.
Good morning, Roseanne.
Thank you. Good morning to you.
All right. In the spirit of time, we're going to go ahead and get started. So far, it's Roseanne, Sarah, and Darlene. And who else was just able to join?
This is Yvonne from Mount San Rafael Hospital in Trinidad, Colorado.
Good morning, Yvonne. All right. So this is Meredith from Telligence. Thank you for joining the call this morning. We actually had a registration list of about 13 this morning, larger than usual, so we may have others joining us here in the next few minutes. But coming out of the April conference on DSMES sustainability, we were certainly hoping that others would want to join. So thank you for spending your time with us this morning. And Darlene, if you haven't been with us before, now is a perfect time to join because we're wrapping up a series we've been doing and moving into hearing feedback on what would be most useful for this group as far as support from us moving forward. So welcome.
Thank you. I was on, but it's been like, 6 months or 7 months since I was on a call. So.
All right. Well, welcome back.
Thank you. And, yeah, I'm very interested, especially in what you're doing with Telligence and the self-management classes and stuff. So.
All right. So my name is Meredith. Again, I'm Senior Quality Improvement Facilitator for Telligence, based here out of Greenwood Village, and we are contracted with the Centers for Medicare and Medicaid Services and have a diabetes care task, and that's what brings me specifically to this work. Work on diabetes self-management in a few different angles. One is this, where I'm so fortunate to work very closely with INCA at the Department of Health for increasing utilization of ADA and AADE recognized and accredited diabetes self-management services in Colorado. And secondly, helping bring resources for self-management into underserved communities in Colorado that may not have the same clinical resources that you all have in your own communities through the ADA or AADE programs through a peer-led, the Stanford DSMP curriculum, and then also working with healthcare providers throughout the state for helping them with resources and treating their patient population with diabetes. Inga?
Good morning, everyone. My name is Inga Zaku, and I'm here at the Colorado Department of Public Health and Environment. And I join these calls, I co-host them with Meredith as part of a CDC grant that we have to increase utilization and participation of diabetes self-management education and support programs accredited and recognized by ADA and AACE. And we really, the primary purpose of these sharing calls is to partner with you all to really discuss what some of those barriers are to increasing utilization of the DSMES code, as well as share success stories, identify tools that may be helpful in increasing DSMES utilization throughout the state. So that's what brings these calls to support you all.
Thank you, Inka. So on this slide, just giving a little bit of a visual of where we started, where we've been, and where we hope to go. Just added a disclaimer up in the left-hand corner here that we have a lot of variety in folks that join us on the call from different settings. And so as we talk about information, it's very important to know that DSMES regulations and reimbursement definitely vary by setting, so you'll always want to take that into consideration. If we look at basically the bottom of this arrow on the bottom left-hand corner and where we started, it's been a couple years now that Becky Diorio, myself, and Christine Falabelle started these first calls, and really weren't sure where they were going to go or what we'd be up to, but have progressed nicely. Since then, Becky has moved on to focusing on the diabetes prevention program, and that's when Inca came in, and I started with working with Inca specifically to really think about these agendas and how we can be most helpful. So the second dot on that arrow, we did a Survey Monkey early on to elicit feedback from participants on what they felt would be most helpful to discuss. That leads us up there to the middle where we started a sharing call series on the DSME Business Plan Guide and started going through that business plan guide section by section. That is a guide that's available on the CDPHE website, which is on the last slide today. Those resources are all available there, but that really gave us an opportunity to dive deep into some specific topics, have some facilitated discussion about what's working for you all, what are the gaps and barriers, and how we might be able to help with that. That DSME Business Plan Guide was developed by Marianne Hedorowitz, who is a national expert, a very entertaining expert on the topic of DSMES and MNT. So that resource, along with a lot of others, live on the website. And if you haven't had a chance to go out and look at those, we would encourage you to do that. So that then led us to the April DSMES Sustainability Conference. And in this conference, Marianne was the presenter for the day. So that really wrapped up that series on the business plan guide and then is launching us into the next phase of what's next for this group and how we can best support you. So based on the conference evaluations, the feedback that we've gotten from these calls historically and that Survey Monkey early on, that's really what we're using to inform our progression together moving forward.
Just a couple of housekeeping reminders to keep yourself on mute, and so you can either use star 6 to mute mute or unmute yourself, or the mute functionality on your phone. Please don't place us on hold because oftentimes we'll hear hold music. When speaking, please state your name. Really encourage in-depth sharing, so please step up and step back. If you feel more comfortable, we do have the chat feature on the right-hand side, so you can chat questions and comments. And then the meeting recordings are going to be available on request for the next few months. Typically, I always put them, I embed them in a call note, but since I'm going to be on leave for the next 3 months, if you want a recording of this presentation, just email Meredith and she can send it to you. And then when I get back, I will redo the call notes with the recording link.
Thank you, Inca. All right, so it's time for us to hear who we have on the call. For those of you joining us today, maybe for the first time or it's been a while, what we like to do on this slide, if you go up to the upper left-hand corner of your screen, you'll see a pen icon. If you left-click on that, and then right under the pen, there's a right arrow, left-click on that, and then move that arrow to where you're located in the state. Left-click again, and it'll drop your arrow. So we see Roseanne is with us here in Denver, Yvonne from Southern Colorado. Good morning, Barbara. Inca, myself. We've got Sarah here in the metro area. Good morning, Jana. And
Good morning.
Hi. And then, Darlene, you said you're up in Teller County.
Yes, I'm on the phone only at the moment. Sorry.
No problem. Thank you. Do we have anyone else that's on the phone only this morning?
And I'm on the phone only.
Good morning, Jenny. You sound like you're in a far away land. We can barely hear you, but welcome. Thanks for joining.
Oh, dear.
There you go. That's better. Thank you. Anyone else that hasn't been announced or announced themselves? Great. Good group this morning. And Kari, thank you.
We always have learning objectives for every call, and so today we are going to review the summative evaluation results from the April 20th conference. So everyone that attends the conference completed an evaluation, which was very helpful. So we compiled the results of that, and we're going to share them with you. And then we really just want to hear more from those that were able to attend. Share something you were able to implement immediately and something long term. And then we definitely have folks on the call who weren't able to attend the conference, and so we really want to find opportunities to share the tools and resources from that conference, and how can we pull you in of what people have learned and what was very helpful for them. So that's what we hope to have a facilitated discussion on today.
So for our polling question today, we'll open this up here after we go through the responses. If you could indicate what best fits you. The question is based on previous feedback we've gotten from evaluations and the Survey Monkey and these calls. We'd like to know what topic you would rate as your top or highest interest and priority to your DSMES program today. And if you don't have a program, that's okay. You can still vote on one of these options. So, clinical quality improvement process. Second is DSMES and MNT insurance coverage specific to Colorado. Next, reaching unengaged and potential DSMES program participants. Strengthening partnerships with clinicians, billing departments, and community organizations. Identifying resources and tools to address social determinants of health, such as food insecurity, affordable housing, and topics such as that. DSMES marketing, or process for helping clinicians keep updated on the medical standards in diabetes care. There's a lot mentioned there, but really we're trying to get highest interest as of today. So we'll go ahead and open up that poll. And once you have the ability to make your selection, be sure to submit or click the submit button on the screen.
Is the poll open?
I'm not seeing it. Emily, are you able to open the poll for us? Thank you. And you can scroll down on the right-hand side to see all of those options and then make your selection. Give it a little bit more time for this question. Always feeling like we need the Jeopardy music right here for Final Jeopardy. We'll get the results here in a second. All right. So nearly half are voting on clinical quality improvement process. We have a few for reaching unengaged and potential program participants. And Inka and myself never answer the questions, so very good that we landed in just a few of those categories. Thank you for doing that. Jenny and Darlene, since you're on the phone only today, Jenny, do you want to weigh in on one of those topics?
Actually, I was able to submit my response, so now I'm on the WebEx.
Oh, very good. So you were able to vote?
Yes.
Okay. And Darlene, does any one of those topics, is that of particular interest to you?
I hate to be an outlier, but the social determinants of health one
Okay.
of interest to me.
No problem for outliers. We like diversity, so thank you. All right. So this is some of the very high points from the summative evaluation from the April conference that Marianne came in for. This text for me is really unclear on this slide. I hope, can you all see it okay?
It's a little blurry on my end too, Meredith.
Okay. So overall, I would just give Inka a huge virtual high five. She really did all of the heavy lifting for putting this conference together and the timing of it. And it was obvious through the evaluation feedback that everyone in attendance really got some kind of high value out of the conference. We had 39 of the 44 attendees from the conference respond to the survey that was required for the CEU credits. And we also had 21 of the 51 ADA or AADE programs present at the conference. And I drove Marianne to the airport after the conference. She was really impressed with that level of attendance. She said historically she's used to seeing maybe 25 on average attend these types of statewide conferences. So we were really pleased with the turnout and hope that you all really had a great opportunity to network with some of your peers in person. Speaker, almost unanimously, people voted that Marianne was extremely engaging. She effectively demonstrated using tools. She had really good expertise. She used appropriate teaching strategy, humor, and visuals, so a lot of free-form comments and just high, strongly agree ratings on Marianne as a speaker. Some of the specific mentions for things that went well was prudent use water. CDPHE was very generous in paying for hotel and mileage, and that was certainly mentioned. A lot of people appreciated having the binder and materials as a takeaway. There was a general comment, one of the best diabetes teaching sessions I've ever attended, and again, just many positive feedbacks on the presenter. For future events, suggestion is more of the same. As far as areas for improvement, a lot of folks felt like they wanted to interact more as a participant, so we'll definitely keep that in mind. But we're also glad you're on these calls because that's really what we want to foster through these calls is that peer-to-peer interaction and sharing. A lot of you felt like there could be more time taken for the amount of content covered, maybe even considering a 2-day training. There were some suggestions for maybe thinking about room layout, and then the PowerPoints, a lot of information on a lot of slides that maybe were a little bit hard to read, so suggesting 2 slides a page instead of 3. So just overall, really great feedback. As far as how Inka and I then will use that information, number one, definitely to inform the topics on these calls. also to inform future events and possibilities there. You all definitely have access to one-on-one free technical assistance with Mary Ann. We would like to get conference materials to those not attending if they would be useful. And then lastly, just continue to encourage peer-to-peer network and resource sharing. So, anything you want to add to that before I advance the slides?
No, you did a great job. Thank you, Meredith. And also, big kudos to you, Meredith. I couldn't have done it without you either. So, it was a team effort.
Well, thank you. All right. So I'll turn it over to you, Inka.
Great. Awesome. Well, this is the part where Meredith and I really want to hear from you all. So, it's a really two simple questions on if you could all just share with the group something you were able to implement immediately and something that you are planning to implement long term. So that's really, we're here just to listen and take notes and share that with the rest of the people who weren't able to be on the call. So who'd like to start?
This is Roseanne. I'll start. So something that I was able to implement immediately is some of the teaching tools that Marianne showed us for using classes. I went and purchased some of those things and, or starting to use them in our classes. Something that we're planning on using long term is the guidelines on the CQI and how to do that.
So Roseanne, all of those visuals that you're referring to, the teaching tools,
Right, like the way she showed what A1C is and different things like that, yeah.
And then just to kind of get a little bit more detail, the CQI tools in the PowerPoint, kind of examples of how you can do a CQI to meet your standard 10?
Yes.
Great. Perfect. Anyone else would like to share?
Sure. This is Sarah at Denver Indian Health. One of the takeaways that I addressed, the Monday following, was that F2HC E&M billing code. I had no idea that had existed. So got the ball rolling with our biller and coder to figure out how we should be utilizing that. He's been adding it all along. We're grant funded, so we're kind of buffered from billing, and the F2HC component too kind of skews billing, but that was very interesting. And then long term, I love her little marketing materials, the little lifesavers, and just the creative acronyms. So kind of looking at that in the future, kind of how can we integrate some of those fun marketing tools.
Great. And were you able to be on that webinar we hosted a few weeks ago on F2HC, Sarah?
I don't think so. I don't think so.
I will email you the link and the resources. So we hosted a 1.5-hour webinar on how to bill for F2HCs for DSMES.
Ooh, okay, yeah, that would be great. I'd be interested.
So I'll send that to you.
Thank you.
This is Barb Johnson in La Junta, Colorado.
Barb.
I was thankful for Mary Ann's representation on how to do a quality of life outcomes assessment, or a CQI. Just made it very simplified, and that was an area I was wanting to use in my program and didn't know how to go about it. So I'm grateful for that.
Great.
This is Jenny, and I loved Mary Ann's presentation, and I think specifically the information on CQI and just examples of how to implement CQI, and I was just amazed that there's a lot of programs that that was their primary barrier, was implementing CQI, and we're kind of working on that just in the organization that I'm working in, so that was really, really helpful to get some of that information.
Thank you, Jenny. Yeah, the CQI materials I thought were really great as well, and we have a lot of initiatives here at the health department with clinical quality improvement. So hearing this information from you all, I'm able to speak the case to our CQI team to find ways how we can support our diabetes self-management quality outcomes. So this is really great to hear from you all. Just in the last few minutes, is there anyone on the call who is not able to attend the conference? Did everyone?
This is Darlene. I didn't get to attend the conference. I sent somebody else that does the Stanford diabetes self-management classes. And he has started working with you guys, Intelligent, doing some trainings again because of funding shifts. What was happening?
So this is Jim Munzer, Darlene?
Yeah.
Okay, great.
This is, yeah, okay. Yeah, thank you.
Yeah, and just for to make sure that we're clear on our end, you're always welcome to stay on these calls when we talk about the ADA and AADE programs. These are the programs that have certified diabetes educators, typically in a clinical setting, sometimes in a health department that can actually bill for these services. So if you ever feel like there's something you need clarification on, definitely reach out to me individually. But in addition, I would welcome you emailing or calling me, and we can talk specifically about the Stanford community-based education that we're also helping with throughout the state.
Perfect. And I'm looking at the bigger picture, but I'm not attached. I work in a whole bunch of different providers' offices and community organizations, so that's my role in the community. And so this is one of the areas for all the education, and I will reach out to you individually.
Great. I look forward to it. Anyone else?
It doesn't sound like, I think everyone else on the call attended the conference, so hopefully someone on the noon call did not, and I can capture some notes at the noon call and then share it out with the call notes. But because we're almost at the top of the hour, we just have a couple more slides, so we'll just finish up this call. And
so for next step, Inka and I will be meeting using, again, the polling information from today, the discussion and conversation to determine the agenda. Inka is going on maternity leave. She's due the end of this month, so really excited about that addition to the family. So it will be me flying solo for the next 3 months on the call. We also, CDPHE and Intelligent have new contracts coming through really essentially about the same time. So Inka and I are doing a lot of brainstorming around what we want to write into our contract work to help support this going forward. And we're also discussing data and how we can really start looking at some type of data that will help us keep a pulse on what DSMES and MNT utilization has done in the last few years as far as trending and where it goes into the future. That's our ultimate objective for these calls and sharing, is to be able to increase that billable covered funding so that you all are reimbursed according to the time and passion that you put into providing these services. So we'll also be looking at that moving forward.
just wanted to remind everyone of some resources we have available. We have Becky DiOrio here at the Health Department, who is our state expert on the National Diabetes Prevention Program and the newly covered benefits through Medicare, so Medicare Diabetes Prevention Program. So if any of you are interested in learning more about that or want to connect with us, here's your contact info. And then also we have that free technical assistance 1-hour call with Marianne Hodogowicz through Telligent. So please contact Meredith if you're interested. The contract goes to the end of September, so please take advantage of that. And then finally, just thank you so much. Again, we really appreciate you being on these calls. They're for you. So on the right-hand side, there will be a survey that will pop up. So please take the short survey of the benefit of these calls. So have a wonderful day, everyone, and I will talk to you all in September.
Thank you, Inka. Thanks, everyone. Have a great day.
Bye, Inka.